7 fruits posing significant health risks for older adults. Certain fruits, while seemingly innocuous, pose significant health risks to the elderly. Commonly consumed fruits can contribute to hypertension, renal failure, and even life-threatening complications. This video will identify 7 such fruits that seniors should avoid. Notably, the third fruit on the list can induce cardiac arrest. Viewers are strongly urged to watch. 1. Star fruit. Elderly individuals, particularly those with compromised renal function, are at significant risk of serious health complications from K consumption. This risk stems from the presence of carboxin, a neurotoxin readily filtered by healthy kidneys. However, a substantial proportion, 1/3 of the elderly population, experiences undiagnosed renal impairment, leading to carboxin accumulation in the bloodstream and potentially severe adverse effects. Severe neurological damage in the elderly from starfruit consumption. Carboxin, a neurotoxin present in starfruit, accumulates in the bloodstream, particularly impacting individuals with impaired renal function. This accumulation can lead to serious neurological complications including dizziness, disorientation, confusion, nausea, vomiting, seizures, and coma. A case study illustrates this risk. A 72-year-old Florida man, John, regularly consumed starfruit in his morning smoothies. He subsequently experienced sudden memory loss, dizziness, and extreme fatigue, initially attributing these symptoms to aging. His condition rapidly deteriorated, resulting in a collapse requiring emergency medical intervention. Diagnosis confirmed severe neurological damage induced by starfruit consumption due to previously undiagnosed mild renal insufficiency. The National Kidney Foundation strongly cautions that even a single starfruit may cause significant neurological harm in individuals with compromised kidney function. Many remain unaware of underlying renal impairment until severe symptoms such as fatigue, ankle swelling, and altered urination frequency manifest. Safe alternative solutions. Instead of consuming starfruit, which poses significant health risks to the elderly, safer alternatives with comparable textural properties are readily available. For instance, Asian pears offer a crisp, juicy texture without the neurotoxic compounds present in starfruit. Similarly, dragon fruit provides a subtly flavor profile and is rich in antioxidants, posing no detrimental effects on renal function. These fruits represent viable and demonstrably safer options for individuals with compromised kidney function, mitigating the risks associated with starfruit consumption. The selection of these alternatives ensures the enjoyment of similar textural experiences while prioritizing the health and well-being of the elderly population. 2. Grapes. Grapes, while diminutive in size, pose significant health risks for the elderly, primarily involving choking hazards and potential kidney damage. Despite their antioxidant properties and associated health benefits, the serious risks associated with grape consumption are often underestimated. The consumption of grapes presents several significant health risks for the elderly population. Firstly, the size and texture of grapes pose a considerable choking hazard, particularly for seniors experiencing dysphagia, difficulty swallowing. Age-related decline in swallowing function, often stemming from weakened pharyngeal muscles, neurological conditions such as Parkinson's or Alzheimer's disease, and diminished cough reflexes, significantly increases this risk. A documented case involved a 78-year-old Californian woman who suffered severe respiratory distress after consuming grapes. The slippery nature of the grape skin hampered removal, resulting in critical oxygen deprivation before emergency intervention. To mitigate this risk, it is strongly recommended that grapes be cut into smaller pieces or mashed before consumption by the elderly. Secondly, the high potassium content in grapes presents a serious threat to individuals with compromised renal function. Impaired kidney function hinders effective potassium filtration, leading to hyperkalemia, elevated blood potassium levels. This condition can manifest as cardiac arrhythmias, muscle weakness, paresthesia, numbness and tingling, and an increased risk of stroke or cardiac arrest. This risk is particularly pronounced in elderly patients with chronic kidney disease, CKD, and those taking ACE inhibitors or potassium-sparing diuretics. Finally, the high glycemic index, GI-53, of grapes can trigger rapid spikes in blood glucose levels, posing a substantial danger to individuals with diabetes or insulin resistance, conditions prevalent among the elderly. A documented case involved a 75-year-old man with type 2 diabetes who experienced dizziness, diaphoresis, excessive sweating, and tachycardia, rapid heart rate, after consuming a large quantity of grapes. Subsequent blood glucose testing revealed a dangerously elevated level of 250 milligrams per deciliter, highlighting the potential for severe complications. Therefore, careful consideration and potentially restriction of grape consumption are crucial for maintaining the health and well-being of the elderly. Safe alternatives. For seniors desiring a sweet yet safe fruit option, consider the following. Berries, strawberries, blueberries, raspberries, low in sugar, rich in antioxidants, and do not excessively elevate potassium levels. Apples, peeled, high in fiber, contributing to improved blood sugar control. Ripe soft pears offer an easily masticated texture, minimizing the risk of choking. 3. Oranges are a popular fruit rich in vitamin C, boosting immunity and offering antioxidant benefits. However, in older adults, oranges may negatively impact the digestive system, increasing the risk of acid reflux and potentially interacting with certain medications. Negative impacts of oranges on the elderly. Gastroesophageal reflux disease, GERD. Oranges possess high acidity, pH 3.0–4.0, potentially stimulating gastric acid secretion, leading to heartburn, chest pain, throat burning, and increased risk of gastritis. Individuals most susceptible include the elderly with GERD, those with a history of peptic ulcers, and those using non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and aspirin. Case study: a 72-year-old woman experienced frequent heartburn and epigastric pain. She consumed a glass of fresh orange juice daily, believing it beneficial. After several months, her gastric discomfort intensified. Medical examination revealed acid-induced gastritis, prompting cessation of orange juice consumption. Drug interactions. Oranges can interfere with medications crucial for the elderly. Beta blockers. The elderly often use beta blockers, e.g. metoprolol, atenolol, for blood pressure control. Oranges are high in potassium, and beta blockers also elevate blood potassium levels. This combination can cause hyperkalemia, resulting in cardiac arrhythmias, muscle weakness, fatigue, and paresthesia. Anticoagulants. Warfarin. Oranges are rich in vitamin C. High consumption can affect warfarin's efficacy, increasing blood clotting and raising the risk of thrombosis and stroke. Case study: a 78-year-old man with hypertension took atenolol. He consumed 2 oranges daily. Subsequently, he experienced fatigue and bradycardia. Testing revealed abnormally high blood potassium levels, posing a cardiovascular risk. Increased risk of diarrhea and abdominal pain. Oranges contain substantial soluble fiber, beneficial for digestion, but excessive intake can cause diarrhea, bloating, dyspepsia, and bowel motility disturbances, particularly in the elderly with weakened digestive systems. Individuals with irritable bowel syndrome, IBS, may experience increased bloating and cramping. Case study: a 75-year-old man with IBS consumed 3 oranges daily, believing it health-promoting. Within weeks, he suffered bloating and persistent diarrhea, leading to dehydration and weakness. Reducing orange consumption significantly improved his condition. Safer alternatives. For seniors who enjoy tart fruits without compromising gastric health or medication interactions, consider these options. Peeled apples. Beneficial for digestion and gentle on the stomach. Ripe, soft pears provide fiber without the diarrheal effects often associated with citrus fruits. Cantaloupe or watermelon offer hydration and essential minerals with minimal acidity. 4. Butter. Avocados are a nutritious fruit, rich in healthy fats, vitamin E, potassium, and fiber. However, in older adults, avocados may negatively impact cardiovascular health and digestion, and may interact with certain medications. Negative impacts of avocado consumption in the elderly. Potassium imbalance and cardiovascular effects. Avocados are high in potassium. 100 grams contains approximately 485 milligrams, exceeding that of bananas. Excessive consumption in elderly individuals with kidney or heart conditions can lead to hyperkalemia, resulting in cardiac arrhythmias, fatigue, muscle weakness, paresthesia, and potentially acute heart failure or cardiac arrest. Case study: an 80-year-old man with chronic kidney disease consumed half an avocado daily, resulting in muscle pain, irregular heartbeat, and dangerously high potassium levels, necessitating immediate avocado restriction. Interaction with anticoagulants. Warfarin. Avocados contain vitamin K, promoting blood clotting. which counteracts the effects of warfarin, a blood thinner used to prevent stroke and thrombosis. Excessive avocado intake while on warfarin can increase blood clotting, raising the risk of thrombotic stroke and cardiovascular or cerebrovascular events. Case study: a 75-year-old woman on warfarin for stroke prevention consumed daily avocado smoothies. Abnormal clotting indices increasing the risk of thrombosis were observed, resolving upon avocado cessation. Gastrointestinal distress: avocado's high fat and fiber content, while generally beneficial, can cause digestive issues with excessive consumption. This includes bloating, dyspepsia due to slowed digestion, and diarrhea, particularly in individuals sensitive to fats. Case study: a 78-year-old man consumed a whole avocado daily to lower cholesterol, experiencing bloating and persistent diarrhea, leading to dehydration and weakness. Digestive health improved upon reducing avocado intake. Allergic reactions and contact dermatitis: some elderly individuals may experience avocado allergies, manifesting as itching, rashes, lip swelling, and potentially respiratory distress or anaphylaxis in severe cases. Avocados contain chitinase, an enzyme that can cause contact dermatitis in susceptible individuals. Case study: a 70-year-old woman with a latex allergy experienced a rash, oral itching, and lip swelling after avocado consumption. A diagnosis of cross-reactivity due to chitinase led to the recommendation of avocado avoidance. Safer alternatives: for seniors seeking nutritious alternatives to avocados, consider these options. Almonds or walnuts provide healthy fats without excessive potassium. Olive oil lowers cholesterol without the bloating associated with avocados. Ripe bananas offer potassium but in lower quantities than avocados, making them a safer choice for individuals with kidney or cardiovascular conditions. Number 5. Watermelon. Watermelon poses several risks for the elderly. Adverse effects on blood glucose: watermelon has a high glycemic index, GI, of approximately 72, causing rapid blood sugar spikes after consumption. For the elderly, particularly those with diabetes or prediabetes, excessive watermelon intake can lead to sudden hyperglycemia, resulting in dizziness, fatigue, and excessive thirst. This can also exacerbate diabetes, increasing the risk of cardiovascular complications, kidney failure, or blindness. Case study: a 72-year-old woman with type 2 diabetes consumed half a watermelon on a hot day. Her blood glucose level surged to 250 mL, causing dizziness and weakness. Her physician advised her to limit watermelon consumption or combine it with high-fiber foods to mitigate the impact on blood sugar. Increased risk of potassium imbalance and cardiovascular complications. Watermelon is rich in potassium, 112 milligrams per 100 grams, which can accumulate in the bloodstream if the elderly individual has impaired kidney function. Excessive potassium can cause irregular heartbeat, palpitations, increased risk of heart attack or acute heart failure, and numbness or weakness in the extremities. Case study: a 75-year-old man with a history of heart disease and hypertension consumed watermelon daily during the summer. After several weeks, he experienced fatigue and shortness of breath. Medical examination revealed elevated blood potassium levels, posing a risk of cardiac arrhythmia. Exacerbation of renal failure in individuals with chronic kidney disease. Watermelon's high water content, over 90%, can overload the kidneys, especially in individuals with renal insufficiency or weakened kidneys. When the kidneys cannot process excess water and potassium, the elderly may experience edema, swelling in the ankles and face, increased blood pressure due to fluid retention, and a worsening of renal failure. Case study: an 80-year-old woman with mild renal insufficiency unknowingly consumed 3 to 4 large slices of watermelon daily for hydration. Over time, she developed leg swelling, shortness of breath, and increased blood pressure, requiring hospitalization for fluid management. Safer alternative solutions. For elderly individuals seeking refreshing yet safe fruit consumption, the following options are recommended. Apples and pears, exhibiting lower glycemic indices, mitigate the risk of sudden blood glucose spikes. Cucumbers provide hydration without excessive sugar or potassium content, making them a suitable choice. Finally, blueberries, rich in antioxidants, offer significant cardiovascular and neurological benefits. These selections represent a prudent approach to fruit intake, prioritizing health and minimizing potential adverse effects associated with higher sugar or potassium levels. The selection of these fruits should be considered a part of a broader, medically supervised dietary plan for optimal health management in the elderly population. 7. Bananas. Potential risks of banana consumption in the elderly. Potassium imbalance and cardiovascular implications. Bananas are exceptionally rich in potassium, approximately 358 milligrams per 100 grams. Excessive consumption can elevate blood potassium levels in the elderly, particularly those with pre-existing cardiovascular disease or renal impairment, leading to cardiac arrhythmias, abnormally fast or slow heartbeats, fatigue, muscle weakness, and paresthesia, and increased risk of stroke or heart failure in cases of severe hyperkalemia. Case study: a 70-year-old man with mild heart failure and hypertension consumed 2 to 3 bananas daily. Subsequently, he experienced bradycardia, dizziness, and weakness. Medical examination revealed hyperkalemia, a condition potentially fatal if left unmanaged. Blood glucose impact and implications for diabetics. Ripe bananas possess a relatively high glycemic index, GI, of 51/62. Consumption can rapidly increase blood sugar levels, posing significant risks for individuals with diabetes. Excessive intake may result in sudden hyperglycemia, causing fatigue, thirst, and headaches, and impaired insulin control, potentially exacerbating diabetic complications. Case study: a 75-year-old woman with type 2 diabetes consumed 2 bananas daily, believing them to be healthy. Within a week, she experienced consistently elevated blood glucose levels, prompting her physician to recommend reduced banana consumption and substitution with apples or berries. Constipation or diarrhea. Due to high fiber content, unripe bananas are rich in resistant starch, potentially causing constipation if consumed excessively. Ripe bananas contain sorbitol, a sugar alcohol that can induce diarrhea in large quantities. Elderly individuals with sensitive digestive systems may experience dyspepsia, bloating, and flatulence, and either loose stools or exacerbated constipation, depending on banana ripeness. Case study: an 80-year-old man with mild constipation consumed unripe bananas daily to aid digestion. However, his constipation worsened due to the resistant starch slowing digestive processes. Potential for sedation and reduced alertness. Bananas contain tryptophan, an amino acid that contributes to serotonin production, potentially inducing drowsiness and reduced alertness. Furthermore, their magnesium content, while promoting muscle relaxation, can cause fatigue in the elderly if consumed in excess. Case study: a 78-year-old woman regularly consumed a banana each morning, subsequently experiencing drowsiness and lethargy. Upon reducing banana intake and substituting with protein at breakfast, she reported improved alertness. Safer alternative solutions. For elderly individuals seeking nutritious fruit consumption without compromising health, the following options are recommended. Apples and berries, possessing a low glycemic index, demonstrably benefit cardiovascular health and digestive function. Cucumbers and grapefruits, characterized by their low sugar content, effectively contribute to blood pressure management and improved digestion. Pears and plums, rich in dietary fiber, facilitate healthy digestion without significantly elevating blood glucose levels. These choices represent a proactive approach to maintaining optimal health and well-being in the elderly population, offering a balanced nutritional profile while mitigating potential health risks associated with high-sugar fruits. The selection of these fruits should be considered a crucial element of a comprehensive dietary strategy designed to support the specific needs and health conditions of older adults. We have identified 7 fruits that pose health risks for the elderly, several of which may be surprising. Number 3, in particular, is unexpectedly harmful. Share in the comments below any fruits you previously considered harmless that have proven otherwise. For further information on foods that promote longevity and well-being in the elderly, please watch the accompanying video. Subscribe to our channel for continued access to crucial health information.